Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Okay, we're going to start the next session, the abstract presentations. So we're going to start with Dr. Hanaa Al Ahmary.
Bismillah ar-Rahman ar-Rahim. On behalf of my colleagues, I'm going to present the abstract of the retrospective study that we conducted about neuropsychiatric manifestation among systemic lupus patients at a tertiary hospital in the southern province of Saudi Arabia. As we all know, neuropsychiatric disorder is a well-known manifestation of systemic lupus, which has been pronounced in about 40% of lupus patients. However, this major clinical aspect of systemic lupus has been underdiagnosed due to lack of a regular psychological assessment, vague presentation, or missing the follow-up. This missing of the diagnosis and lack of management have a detrimental negative effect on the disease activity and the overall psychological health. So the aim of the study, we conducted this study to evaluate the frequency and pattern of a neuropsychiatric manifestation among lupus patients at Asir Central Hospital, which is a tertiary hospital that presents most of the patients in the southern province. And this of course will increase our awareness of suboptimal psychological assessment of lupus patients, which has a pivotal importance on their quality of life. The study was a retrospective, descriptive, and conducted in a single center. This slide summarizes the method that we use. As mentioned, is retrospective. That done at Asir Central Hospital. We collected the data from the electronic files and the file chart over 5 years, from January 2012 to December 2017. We came up with 318 lupus patients. Next, we included only the patient who defined to have a neuropsychiatric manifestation based on the ACR criteria. And any patient who did not have a documentation of a neuropsychiatric disorder or have missing files or missing data were excluded. And we ended by 50 lupus patients with MPSLE. Then all the information or relevant information have been extracted from the files, like biographic information, types of clinical manifestation, and neuroimages, and serological markers, and the treatment as well. All the information was statistically analyzed by using SPSS. Result summarizes. Slides are not appear. However, there are a lot of missing slides. It's not the image is not showing in the slides. We ended up the statistical analysis showed about a quarter of the collected total lupus cohort were having a neuropsychiatric manifestation. Half of them have a neurological disorder, 36 of them have psychological illnesses, and the remaining 12% have both a neurological and psychological disorder. This table also summarizes these manifestations distributed according to the age, gender, and disease duration. And as expected, 96%, the majority of the patients were females. And interestingly, they presented these manifestation earlier, commonly in the first 5 years. In addition, we also have a bar chart summarizes those manifestations, and we found that the headache is the most common neurological manifestation, and the ischemic stroke was the second most common neurological manifestation. In contrast, depression was the most common psychological disorder among our patients. This table also illustrates all the studies have been conducted among different sectors around the kingdom. The one in the blue was conducted in the central region, the yellow in multicentric between Riyadh and Jeddah, the one in the purple from western province, and the yellow row from the eastern region from Al-Hassa, and our study was the latest row. And as you can see that the incidence or the percentage of depression in our cohort almost similar to other results conducted or found in the other studies like a multicentric and eastern region. The same also for the incidence of seizure. It's almost the same as the result found in the other studies. However, the incidence of psychosis is much lower than the incidence or the percentage in the other regions, and the headache also was markedly higher than the percentage of the trials that have been conducted in western and eastern regions. So this variation of the incidence between especially psychosis and headache, is it due to missing data in the files? Is it due to misinterpretation, or if they really have a depression? And if they have a depression, how bad is it? Do we have a measurement tool of the depression or not? Do we have a good collaboration as a rheumatologist with a psychiatrist? All these questions raised up, and we have to solve it in the foreseeable future. So to conclude, we concluded from this study that among lupus patients, neurological manifestations were the more prominent than psychiatric manifestation. Headache and stroke are the most common, while depression is the most prominent psychiatric disorder. The psychological assessment of lupus patients is noticeably under-evaluated, and implication of measurement tools and multidisciplinary teamwork is mandatory. This is my references. Thank you.